Welcome to the Health Update. I'm Madison Kasper. With me is Dr. Aarti Raja, Mako Media's Science and Health Advisor. Welcome, Dr. Raja.
Thank you, Madison.
Our topic today is the recent rise in flu cases across the United States. Dr. Raja, we've been hearing a lot about the flu. What is the flu?
The flu is actually a highly contagious respiratory tract disease that is spread by a virus, which is the influenza virus, which we call as the flu virus.
So what are the symptoms of the flu?
The symptoms mainly include a sore throat, a cough, accompanied by fever, and the classic symptom of the flu is fever accompanied by chills. So you kind of feel cold at times and then hot at times. And then the usual runny nose, weakness, or fatigue, that you just feel tired all the time. So these are the main classic symptoms of the flu.
How can the flu be treated?
So for most of us, for an average healthy individual, the basic treatment is just get rest. Isolate yourself, drink lots of fluids, and take rest. But there are cases where it can become a severe case of the flu, and for those instances, there are what we call antivirals or medication that can be taken against the influenza virus, and there are currently 4 available on the market.
Recently, it came out that this flu season has been the most intense than it's ever been in the past at least 15 years. Why is that?
One of the reasons is simply because we've kind of forgotten what pre-COVID days looked like. The numbers right now are actually closer to pre-COVID days, which is kind of like saying that's normal. This is like the normal number. Because during the COVID years, we were more careful about a lot of things. We were isolated. We were using more protection for our nose and our faces. So we probably weren't spreading the flu around as much. So numbers dropped during those years, the flu numbers. But now that we've done away with all those precautions in place, the flu numbers seem to be going up. One of the other reasons as well is what they're noticing is maybe there are fewer vaccinations that are happening in the recent past against the flu, which might explain some of the increased numbers in flu cases.
You mentioned vaccines. What vaccines are available?
So yearly, we have vaccines available against influenza. So as long as individuals go in and get vaccinated, then you will be protected against this virus or against getting the disease. And even if you do get the virus, the disease burden is considered to be lowered, which basically just means you're not going to have an extreme case of the disease, and an individual will be prevented from getting to a hospital. You are not going to reach that stage of hospitalization. You will be much more protected than if you never took the vaccine and ended up getting the flu.
Any last thoughts?
Again, the same thing. Because we're all in close proximity with each other on a daily basis, the best way to prevent or protect yourself would be to get that vaccine on a yearly basis. If you're unable to get it, then at least add these precautions to your daily life. Wash your hands well, keep yourself away from someone who may be sick, and if someone is sick, be aware of the fact that you might want to keep yourself away from the rest of the crowd.
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.